Compliments of the season. Good morning and thanks for joining us on the Thursday edition of TVC Breakfast. Let's bring you the news update at this time. Nigeria is witnessing a surge in COVID-19 cases. In the last 2 weeks, the country recorded a 500% increase in the number of confirmed cases due to Delta and Omicron variants. Latest data by the Nigeria Center for Disease Control shows that the country recorded 4,035 new cases of COVID-19 in the last few hours. Lagos, which is the epicenter of the pandemic in Nigeria, recorded the highest number of cases with 3,393 new infections, followed by Rivers with 260 and Edo with 61. The country has recorded 231,413 infections. Out of this number, 211,853 people have been discharged and 2,991 people have died from COVID-19 related complications. But joining me to discuss this is public health specialist Nzabasi Ekanem. Good morning. Thank you for joining us and compliments of the season.
Thank you for having me.
Right.
Compliments too.
Right. Now, the government has said that Nigeria is officially in the fourth wave with the number of infections we are recording in the past few days. And I'm wondering, what are the implications of this continuous rise in cases that we are witnessing for a country like Nigeria?
Well, for Nigeria as a country, it's going to be it's going to place a kind of a strain on our health system. I mean, with the doubling time of Omicron variant, it means that we are going to have a lot of new cases, like you've seen, which is going to be growing in geometric progression. And at a time like this, when we have not been able to even recover from the stress that we experienced previously with other variants, from the Beta to the Delta and all of that, you know, it shows that for us, it's going to be it's going to overwhelm our system much more. And unfortunately, this is happening at a time when Nigerians have completely developed what we call pandemic fatigue, wherein we have completely laid down our guards. The COVID-19 precautionary measures are not being adhered to at this time. And it's also happening at a time when Nigerians are also developing serious apathy for the vaccine. Even as that yesterday, we saw a video that came up with this woman from Jos, in Plateau State, that said that came up with this video of the metallic, the magnetic effect of COVID-19 vaccine. And I mean, you never can tell how far-reaching that video can go in, causing vaccine hesitancy. So for us, it's a very serious challenge, and I think for us, we need to reenact. We need to start all over again.
Right.
So that we can conscientize Nigerians and then tell them that, look, what we experienced in 2020 is back again. We are seeing high increase in number. Probably the only advantage that we have is that Omicron is less. From studies that we've had, it shows that the mortality, the case fatality rate with Omicron is far lesser than the Delta variant. But unfortunately, we are even seeing comorbidities, co-infections with both the Delta variant and Omicron variant. And so Delta variant is going to increase the level of hospitalization, and the same with Omicron. And both of them occurring together with the fact that Delta variant has a higher mortality and Omicron has a higher morbidity. I mean, it is going to be a serious stress on our system. And so I think we need to approach this from the public health angle. Are there behavioral change modification that we can do? Are there community engagement practices that we can?
Are there?
We need to actually intensify this. And we need to also, complement the effort of the National Primary Healthcare Development Agency. As I speak to you, yesterday I received a report from the Kaduna State Primary Healthcare Development Agency that they just completed the phase of their training, where they are bringing community pharmacists, to start administering vaccine. As I speak to you in Abuja, Community pharmacies are already coming in. So we are already seeing private sector coming. What we need to do at this time, because of the issue of Omicron, and it's coming with, this is going to be the first time we are seeing the variant with such a fast doubling time. And so we need to step up vaccination. We need to roll it out and make sure that as many Nigerians as possible receive the COVID-19 vaccine. So I want to encourage more private sector, which is what we need to do. Private sector, social sector involvement, and of course the public sector. We need to work together at this time so that more Nigerians can have access to the vaccine, and we can all be vaccinated as a prophylaxis for COVID-19 infections. And in addition to that, we need to still make sure that Nigerians adhere to this measure. So at this time, I think we might need to enforce the law that was signed by the president some months ago. That law demanded that all Nigerians must adhere to the public health measure. So it should be considered a crime for those who don't do that.
How effective will that be? We see that even when we had the lockdown, there were still intrastate movement and interstate movement, despite measures put in place. How effective, even if we say we are enforcing, how effective would that be? Well, I think stemming from what we saw.
The law enforcement agencies, they have to be on their toes. They need to work. I'm sure that for now, I've not seen an explicit directive from the presidency directing the law enforcement agency, the police, and the police, the civil defense corps, to enforce the COVID-19 regulations. I've not seen that, but I feel that as soon as that is done, the same way we saw during last in 2020, where law enforcement agents were found on the road enforcing these laws, I feel that if we do that, if we have this explicit order, then the police and other law enforcement agents will make sure that Nigerians adhere to the measure. I think at this time, with the numbers that we are seeing, which is going to grow even in the next few weeks, and mind you, studies are still being undergoing. We are undergoing some studies right now to know more about the case fatality of Omicron. Now, if Omicron is actually having a high case fatality coupled with the high, doubling or the short doubling time, then I think we are facing a very serious issue in Nigeria.
Now, let's look at how states are handling this issue. We see that Lagos State, for instance, has put in measures and effort to really curb the spread of this virus, being the epicenter. But it doesn't seem like that across the country, across the states. And we are still seeing the number of infections that Lagos State is witnessing, that is still higher than most states as it is being recorded. What really is going on? How is vaccination, and also testing, that we are not seeing that balance that we need? How is all of this also perhaps hindering the progress that we intend to see?
Well, as far as Lagos is concerned, I remember I said the last time that Lagos is trying as much as possible. But you see, the problem that we have in Lagos is that Lagos is a cosmopolitan state. People coming from different states, people coming from other countries into Lagos. So we are having both cases of imported cases of COVID-19, because a lot of people are boycotting the quarantine measures that has been stipulated at the port of entry, whether land A or C. Now, that is one. Number two, we are having people coming from other states with COVID-19, and they are coming to Lagos and they are adding to the numbers. Now, unfortunately, it is not possible for us to go on what we call the active surveillance. Active surveillance is when we practically go out to search for the cases. It may not be possible economically for us to actually achieve that. Because of the fact that, Going actively means that you want to go probably from street to street, from door to door, to check active cases.
But we need the data to address this.
It's not just peculiar to Nigeria. For all low and middle income countries, one of the challenges that we are seeing with COVID-19 management and response is the fact that testing is not adequate, and there are economic explanations to that. But then I feel that with the RDT kits that we have, I mean the antigen COVID-19 antigen testing kits that we have, I think it's high time that we engage, like I mentioned before, private sector massively in this. Now, so like what is going on now, Nigerians should be able to move into the nearest maybe pharmacy, maybe laboratory, and have COVID-19 tests carried out. If possible, FOC, free of charge. Because for us, what is important is the data. And when we have data, we can probably be able to design interventions that will help us. Because as far as Lagos is concerned, we are still going to see more cases for the reasons I mentioned before. So what is important now is for us to be able to contain the spread of the virus in Lagos as a place. And another factor that we have to identify is the fact Lagos has a very large population, and the way people move around in Lagos, it's something that we probably need to put in some measures to ensure that if you are in Lagos, if no other state is doing it, Lagos need to enforce COVID-19.
But it's important other states do it so that we wouldn't be having these imported cases of
so there has
COVID-19.
to be a national spread in terms of commitment towards this.
Right, absolutely. And that's a fine place to leave the conversation. Thank you for speaking with us, public health specialist Nsabasi Ekanem, for your time.
Thank you so much.
Right.